the COVID-19 pandemic changed our world and our lives in many different ways. And reflecting on the discussion about the pandemic and the new normal over the past few months, I feel that the discourse around what kind of future we want and what kind of recovery we need to pursue has been shifting. And more than ever before, the pandemic brought to the light that the issue of equity and equality, and this is specifically about this panel discussion is about. Universal health coverage cannot be just an ideal scenario that the governments aspire to achieve, but we must make it happen right now. We have serious unfinished business in terms of sexual and reproductive health.
This notion of the triple dividend, that those investments we make pay off during adolescence itself, for example, fewer deaths by suicide or fewer unplanned pregnancies, fewer STIs, fewer HIV cases in adolescence itself, better health as those young people mature into adulthood, and then the intergenerational benefits that come when, for example, women are older, when they parent and are more educated, and then have healthier children when they choose, if they choose to parent.
Is indifference, ignorance, and prejudices on the part of the care providers impacting on quality of care? Are we, based on our prejudices and our own indifference, leaving people behind? Of course, we need to look at the woman's dignity. How often do we think in terms of dignity, in terms of the doctor-client relationship, particularly in the public sector? So, if you talk about the family and community support, which you can see on the left-hand corner at the bottom here, if you have somebody with a laboring woman, basically you are empowering that woman. Labor is unique. It's a deeply emotional experience for the woman, and uniquely it leaves a woman helpless. There is pain, and there are so many things that are happening. It's a dynamic process. Things can go wrong, and the woman depends a lot on the healthcare provider for her well-being during that time. But if there is somebody else there who is standing, seated, or erect, that empowers the woman. And I believe that will take care of dignity. The woman will get more information. There'll be better informed consent. There's a lot written about, you'll be surprised about how much is written about mistreatment and harm during labor. I looked at the socioeconomic status of the women who died. And here's what I found from the Excel file I have taken off the occupation column. And what I have shaded here are the people that I am certain are of a low socioeconomic status. Monthly income less than 15,000 rupees. And amongst the women who died in the last 5 years, 81.8% belong to this group.
Though I'm a person with disability, I am somebody who's also a beneficiary of a lot of work that I'm doing. But I've noticed that when it comes to barriers, there are many groups out there with fully abled bodies that also face those barriers, and women being a large group in that. We're also a country that faces challenges when it comes to electricity and technology. But slowly these solutions are being implemented, and even if these solutions are there, there's a huge inequality when it comes to who accesses them. For example, if there's a family in a village, there's only one phone, and that probably belongs to the male head of the family. Because of the pandemic, many of the services, they have been shut down. Not just healthcare services, but general lifestyle services. So there's a huge influx that has been diverted towards online, e-commerce, and digital services. Menstrual healthcare or reproduction or reproductive healthcare issues, problems related to a lot of these areas, they do not discriminate against anybody. For example, initially we thought that these problems are more prevalent in the rural areas. Women do not have access to information and services and products, so we were focused over there. But something happened that we were receiving queries from the most posh areas of Pakistan. And these queries were about really basic ideas about vaginal care and having access to any kind of basic service. And I think whenever we're designing campaigns or whenever we're trying to design a project, we need to keep in mind that just because a female gets to travel around the world, or if she has a job, or if she is like an elderly figure in the family, somewhere the barrier of taboo is still over there.
For him, he's called the father of modern pathology. And I always find that interesting. And, those of you, all of you who are doctors here, would know that we're always taught, father of this and father of that. But there is no mother of any specialized field in medicine. And that's because, women were at the point that medicine became formalized and a system was created. Women were not actually allowed into medical colleges. And I think the roots of that really need to be understood if we are to go forward in a way which is equitable. I know we are speaking about, leave no one behind in terms of the community at large. But I think it's also important to recognize that there's a whole subset of community within the medical profession which has been left behind repeatedly. Is that the S of the SRH is very rarely explored in depth for us, even as medical students or as medical professionals. And it's mostly a focus on reproductive health. To be starting to ask new questions about who is it that we are actually leaving behind and who else do we need to take along with us. Something else that is influencing them, and I think as is obvious from the cartoon that I'm showing here, women medical professionals face many, many different barriers and challenges. And unless we are able to recognize those and be able to offer them some solutions to be equitable with their male colleagues, I'm afraid we're going to end up leaving them behind. And I really hope that the medical profession as a whole will take this opportunity of the COVID-19.
There is deep-rooted social norms within our culture that we need to address, and client-centric care comes from also doctors. And even though policies are in place, this will not be implemented if you do not take the initiative to implement them. And I think empowerment overall of patients, of medical professionals, of systems, I think is a key knowledge and thought that we can take away from this conversation.